Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Preparing for Surgery Part 2, Introduction. More than 25 million surgical procedures are performed each year in the U.S. This patient education lesson will help you prepare for surgery. By understanding the different steps, you can help your healthcare providers ensure a successful operation and a fast recovery. A planned surgery involves 4 distinct steps: surgical consultation, pre-surgical visit, day of surgery, patient discharge. During the surgical consultation, the patient meets with his or her surgeon to discuss the surgical treatment options and discuss the benefits and risks of surgery. This program is designed for patients who have already been scheduled for surgery. The purpose of the pre-surgical visit is to check the medical condition of the patient and to plan for anesthesia. This program discusses what happens during the pre-surgical examination and the medical questions you may be asked. On the day of surgery, the patient checks in before going to the operating room. After the operation, the patient is monitored in the post-anesthesia care unit. This program also describes the surgical process and prepares you for the experience. After having surgery, the patient either stays at the hospital or goes home. When patients go home, they are given instructions. This program reviews some of the information discussed during discharge instructions. Day of surgery. On the day of surgery, you will be admitted to the surgical area and an identity bracelet will be placed around your wrist. It is best to wear simple, loose-fitting clothes that will easily fit over a bandage. It is also best to leave jewelry and other valuables at home. All facial makeup and nail polish must be removed. A healthcare provider will review your medical history and perform a brief physical exam. Be prepared to answer questions regarding any medications you are taking. Be sure to tell the nurse or doctor about anything you ate or drank after the time you were told to stop eating or drinking. To have surgery, you need to sign a consent form. Signing the consent form indicates that you know what the surgery is for, understand what the benefits and risks are, and allow the doctors and other hospital staff to proceed with the surgery. During surgery, you will be given a gown to wear. You will then meet your anesthesiologist or nurse anesthetist who will recheck your medical history and test results. He or she will be in charge of your anesthesia care throughout the surgery. Your anesthesiologist may then give you a sedative to relax you before going to surgery. Though you may still be able to walk, you might be taken to surgery in a wheelchair or on a bed, also called a gurney. This ensures safer transportation. You may be taken to a surgery waiting area called holding area before going to the operating room. Depending on the hospital policy, 1 or 2 of your family or friends may be allowed to come with you into the holding area. If the patient is a child, a parent may be allowed in the surgery holding area or the operating room if the anesthesiologist or nurse anesthetist decides this is best for the child. In the surgery holding area, you may see other patients and a lot of activity. If your hair needs to be clipped, it may be clipped there. From the surgery holding area, you will then be moved to the operating room, also known as the OR. If anesthesia has not already been started in the holding area, it will be started in the operating room. In cases of general anesthesia, you will go to sleep and a tube may be placed in your throat to help you continue breathing. In cases of local or regional anesthesia, you may be given some medication through an IV to relax you. The surgeon, anesthesiologist, or nurse anesthetist will then inject the actual numbing medication into the appropriate area.
It will numb you and make it so that you do not feel the surgery.
You will be closely monitored in the operating room. Your anesthesiologist or nurse anesthetist will continually monitor the oxygen level in your blood, pulse, blood pressure, and respiration. They will give you any medications, fluids, or blood that you need. Some of the equipment they may use to monitor your vital signs include a blood pressure cuff to monitor your blood pressure, a finger clip or sticky pad to measure your blood oxygen level, EKG patches on your chest to monitor your heart. An oxygen mask will be used to give you extra oxygen. An intravenous line or IV line is used to give you any medication you need. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Immediately after surgery. Right after your surgery, you will go to the recovery room, which is also called the Post-Anesthesia Care Unit, or PACU for short. This is where trained nurses will monitor you as the anesthesia wears off. While you are in the PACU, your surgeon will meet with your family and friends to inform them about your condition and to answer any questions they may have. The PACU nurse will administer medication to reduce any pain you may have as a result of the surgical procedure. Do not be afraid to ask for more pain medication. When the PACU nurse is satisfied that your condition is stable and pain has been treated appropriately, you will be discharged from the PACU to go home if you are an outpatient. Otherwise, you will go to your hospital room if you were to remain in the hospital. Most patients usually spend 1 to 2 hours in the PACU. Depending on the type of surgery and your medical condition, the amount of time you spend in the PACU could be longer. Patients going home after surgery should not drive, operate complex equipment, make important legal decisions, or drink alcohol for 24 hours. Discharge instructions.
If you are an outpatient, you will be discharged home on the day of surgery. If you are an inpatient, you will be discharged to go home after recovering at least one night in the hospital.
Patients can do a lot to help speed up their recovery. The following are some general suggestions. Your doctors and nurses will give you more specific instructions. These are called discharge instructions. Walk as soon as you can. Walking circulates the blood in your system and reduces the formation of blood clots, which could be fatal. You will have help when you take your first walking steps after surgery. Follow your dietary instructions. You will be given instructions regarding what you can eat and how you can slowly progress from drinking liquid food to eating solid food. Follow these instructions until your digestive system fully recovers from the effects of the surgery and anesthesia. Manage your pain. In the hospital, ask your nurse for pain medication if you feel pain. When you go home, do not double up or increase the dosage of your medication without asking your doctor. Do not smoke. Smoking may increase your chance of developing lung infections known as pneumonia. Smoking also hinders blood flow and can slow healing. Depending on the type of surgery and anesthesia you were given, your doctor may give you additional instructions. Do not be afraid to ask any questions related to your health and recovery. Here is a list of 10 common questions you should ask your doctor and healthcare provider before you go home.
1.
What medications should I take and when?
2.
What are the signs of infections and other common complications?
3.
What should I eat?
4.
What will happen to my stitches and staples?
5.
When will I see the doctor again?
6.
When can I drive my car?
7.
When can I go back to work?
8.
When and how can I shower?
9.
How much weight can I lift? Can I bend?
10.
When can I make love again?
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Thanks to technological advances, surgical procedures are now much safer and less painful. Recovery from surgery is also faster due to new anesthetics and less invasive surgical techniques. The patient plays an important role in ensuring the success of surgery. We have made this program available to you to help you understand the surgical process and prepare you for how you can play an active role in your treatment and recovery. Your doctor and nurse are available to answer any questions you may have about your scheduled surgery.
Thank you for using Explain.